This is a short video about being fitted with a plaster cast. Plaster casts are used to treat broken bones and also to protect soft tissues and wounds after operations. The limb is wrapped in wool and the cast is applied to keep the bone or the limb still so it can heal in the correct position. So what is involved in a cast being fitted? Initially, a stockinette and wool layer are placed over the limb as an underlayer. Then afterwards, plaster of Paris or fibreglass are wrapped around. It is important to look after your plaster cast after it has been fitted. You must keep it as dry as possible. If it becomes wet, it can loosen, degrade and fall apart and therefore lose its function. If it becomes wet, it can also become very irritating and itchy and smell. Commercial cast water protectors are available but can be expensive. I must stress that if your cast does become wet, it's important to come back to the hospital and to the plaster room for it to be assessed and for us to decide if it needs to be changed. A common complaint after a plaster cast has been applied is itching. Itching is very common, especially as plaster casts have to be on for a number of weeks. Do not put anything inside your plaster cast. Itching and scratching can cause cuts and these can become infected, which can be a real problem, especially as they can't be seen. Tips to help prevent this includes elevating the limb or the cast, moving the position of the limb and also tapping the plaster. However, if the itching becomes increasingly problematic and especially if the limb becomes red, it's important to seek prompt medical advice. Day-to-day care of your plaster is very important. Keep it elevated, ideally above heart level, and keep your fingers or toes moving at all times. Regularly check that the fingers and toes are warm and that the sensation or feeling is normal. When out and about, you can place a large sock over the end of the cast to keep your toes warm, but remember to keep them moving at all times and to keep a regular check on them. Avoid placing any creams or powders in and around your plaster cast, as it can lead to reactions and skin irritation, which can cause unpleasant complications. There are a few things to look out for. Fingers or toes could become pale, painful, swollen, cold, tingly or numb. Initially, elevate the limb to see if this helps to relieve symptoms. If this doesn't settle things down and the pain is increasing, the numbness or tingling are persisting, or the finger or toe looks very pale, it's important to come to hospital and seek medical attention immediately, ideally in the fracture clinic or to accident emergency if it's out of hours. If your plaster becomes loose, which often happens as the swelling from the injury settles down, then again please contact the plaster room during working hours so that your cast can be reassessed. It's important because a loose plaster may not hold the broken bone and lead to a worsening of the injury and your pain. If your cast becomes wet, dirty, damaged, rubs excessively or becomes very uncomfortable, please do get in touch with the plaster room immediately to have it reassessed and potentially reapplied. If you're diabetic, you may require regular cast changes as routine. If you're considering flying while your plaster cast is fitted, please do speak to your doctor or specialist nursing team. It's best to avoid flying while you have a plaster cast on because at altitude the limb can swell, but it is still possible in certain circumstances if absolutely necessary. However, after consultation with your specialist doctor or nurse, it may be possible to split or bivalve your plaster prior to flying. It's also important that you discuss the risks of blood clots while travelling, as this is increased while the limb is immobilised in a plaster cast. They will have a discussion with you around your specific risk factors, and it may be that you need some additional medication to reduce your risk of a blood clot. In general, for those patients being treated in a plaster cast or boot and are non-weight bearing, they should be considered for a form of medication to reduce the risk of blood clots. In general, this comes in the form of a small injection that goes into the fat of the belly and would often be given for the duration of time that you're not able to put weight through the leg. When it's time for your plaster to be removed, you'll come back to the Orthopaedic fracture clinic and go to the plaster room. There we'll use a specialist vibrating saw to remove the plaster. It does make quite a lot of noise and vibrates, but it can only really tickle the skin and certainly can't cut it. Once the plaster cast is removed, the under wrapping will also be taken away. If you have any concerns or you're feeling discomfort in and around the area where your plaster cast was, please just contact one of our specialist nurses here in Fracture Clinic and they'll be able to advise you further.